Pleasure. All right, guys. So first of all, I know you guys probably know now, but my name's Ellen Boyd. I am an emergency veterinarian and also a veterinary epidemiologist. And we're going to talk about how that kind of happens, how you can have kind of two titles with as being a veterinarian. But first, a little bit more about kind of a little bit more about me. So I am from New Brunswick. I'm from Sussex, New Brunswick, and I'm actually heading back to the Maritimes in May, and I can't wait. So I did my Bachelor of Science at Acadia University. I did a double major in environmental science and in biology. And when I went into Acadia, I was for sure thinking I was going to be a marine biologist. I was like, that's exactly what I was going to do. But then I started my honors project, and my honors project was looking at common eider ducks on some offshore islands in Nova Scotia. And that's where I got to work with a wildlife veterinarian. And this was a person who was a veterinarian, but she was investigating why there was lower levels of common eider ducks. So she was in the field working with birds, and I was like, whoa, that's super cool. I had no idea a vet would be doing that. So that kind of put my interest into veterinary school. So I applied to the Atlantic Veterinary College, which for people from the Maritimes, that's kind of our veterinary college, and it's in Charlottetown, PEI. And I got in, which was excellent. And when I was starting veterinary school, and probably until the least my third year of veterinary school, I thought I was going to be either a fisheries vet or a wildlife vet or working in some capacity in that regard. I actually did not think I was going to do any clinical small animal, working with cats, dogs, rabbits, or large animal with cows, horses, or things like that. That wasn't really where I thought I was going to go. But in your fourth year of veterinary school, you start your clinical rotation. So up until then, you're just in classes, learning all that information. And then when you get to your fourth year, you get to kind of put all that learning into action. And you start going through clinics, you start learning different types of vet med. So you start doing cardiology rotations, internal medicine, things like that. And I just fell in love with my emergency and critical care rotation. So what that is treating animals that become sick really quickly, and also the ones that become really, really sick and need to stay in the hospital. And I just found that super fascinating. So I went off and I decided to, instead of pursuing wildlife and things like that, at that point, I put that on the shelf and did an internship in small animal medicine and surgery. And that was in Vancouver. And you can see here the picture, that is me in surgery. And I did a year rotating through all the specialties at this hospital. So I did cardiology, I did ophthalmology, looking at eyes, I did neurology about brains, I did surgery and emergency medicine. And then once my internship was over, I became a full-time emergency doctor at this hospital. So I did that and I loved it, and I still love ER. But at the end of about 2020, I felt I was missing that component of interacting with wildlife and looking at bigger populations of animals in regards to disease. So that's where I pivoted back, and I decided to go back and look at epidemiology. And to do that, I started a PhD at the University of British Columbia, where I was looking to become a veterinary epidemiologist, which is how I'm working towards that right now. And I currently work with the Ministry of Agriculture, working as a vet epi to deal with any kind of animal diseases. And for those that don't know, what a veterinary epidemiologist is a veterinarian that studies how disease spreads and how disease impacts different populations. So for instance, when we were in COVID, epidemiologists were the ones working on figuring out how COVID spreads. And you'll see that I get to do that, but for animals. So I both do now the emergency, and I also do that research on the side. So really two different fields. But let's start first with our ER shift. So, how this kind of works is we're going to go through cases exactly how I do when a case walks into the ER hospital. And I want this to be just a very interactive experience. So, I know it can be a little bit daunting to yell out answers and kind of make guesses. So, what we can do is we can either type in the chat, or if you'd like to do one of the reactions for raising your hand, feel free to do that. But I will prompt you and we'll talk about different ways so we can kind of figure out what's going on. So this is how I approach every single case that comes in. The first is getting a history. So first off, you want to know why that pet is in the hospital or coming into the hospital. How long have they been sick? What have they been doing before that? And maybe other medical history, so previous conditions that they may have. The second, and probably one of the most valuable tools we have, is doing the physical exam. So this is actually where I come in, I have my stethoscope, I listen to their heart, I feel their belly, I look in their mouth and do all those things. And often with emergency medicine, unlike when you go for a general physical and you kind of go head to toe, paying the same amount of attention to every part, with emergency medicine, because they're coming in for a certain problem, often we target our physical exam to focus on a few key areas so we can kind of quickly figure out what's going on. So once then we have our history and our physical exam, that's when we make our differential diagnosis. And what that is basically a list of things that we can be thinking of what could be going on with the animal. And when we come up with this differential diagnosis, it's important because that's how we can decide what kind of tests we want to run or what kind of treatments we want to do. So making that differential diagnosis is extremely important and can seem really daunting. And often when I have interns come through an emergency, that's their first thing that they're like, oh, I don't know how to make a differential. So don't feel like when we go through all the things and you're like, oh, I don't know. That's how even people that have graduated vet school feel. So we're going to make it a lot easier and kind of break it down so it's not as scary. And then finally, once we do our diagnostics, so figure out our tests to see what's wrong, then we can do treatments. And that's how we make them feel better and how we can kind of fix their illness or fix the reason they're there. So I think now that we have that base, we'll go through the first case very slow, and then we'll kind of get a swing of things here. So this is our first patient. So our first patient is Pearl. She's a 2-year-old female spayed British Shorthair cat. And just so everyone knows this box she's in. So at my hospital, we're very into keeping cats comfortable. And I don't know if any of you guys have ever had to bring your cat somewhere, but often they don't like to do that. So we have these little hidey houses that we put into their kennels. And this one's a spaceship. I have other ones that are barnyard and some that are jungle. And the cats love them. They can go into the house, and then when they feel more comfortable, they just poke their head out. And it's a nice way for them to feel less scared in the kind of scary environment. So let's first get our history of why Pearl is here. So Pearl actually was feeling really good until about 2 hours ago when her owner said she started coughing and gagging, like something was stuck in her throat. And what they showed me is like they say that she looks like this. She's going like, and they're like, she's never done that before, and they're just worried about that. They tell me she's vomited one time, but she's still interested in eating when they bring her some treats, and she's able to keep those treats down, but then she starts smacking again. Pearl's an indoor only cat, but her owners have a little harness for her, and they bring her out to the backyard where she gets to play and sniff and chew on some plants and things like that. She has no other medical conditions. She's fully vaccinated. She is otherwise a really healthy girl. So what we know right here is we know that she was otherwise doing well, and now she's just doing this. So does anyone have any idea of what body part would be important for us to look at first or during our physical exam? Just anything. anything that might come to mind. If you guys want to put in the chat or shout it out, anyone want to have any ideas? I'll give you a hint. Think about if you're smacking, something's stuck in her throat. I think the owners are right. Something that's going on here. If she's trying to gag and bring something up, that could be what's going on. So I think definitely the throat is going to be a good thing for us to look at. But the other thing we want to kind of make sure we look at are some other parts, and let's go through those. So we're going to look through her, we're going to definitely look at her nose and her mouth. We also want to make sure we're going to examine her lungs. And the reason for that is she's coughing a bit. And that is something that is a bit concerning when we have any coughing going on. And then finally, she also has vomited. So generally when we vomit, that can be something going on with the belly. And we want to make sure that there's no pain or anything going on there. So let's look at our options here. So we see that when we look at her nose and her mouth, that we see that she is drooling quite a bit. And there's a bit of discharge coming from her nose. It is clear, it doesn't have any sign, it's not yellow or green, but there is some discharge there. Her gums are nice and pink, and otherwise that looks okay. When I take my stethoscope and I listen to her lungs, they sound normal. I don't hear any crackles or wheezes that I would normally hear if there is either infection in the lungs or if she's having trouble breathing. So her lungs sound normal. And then finally, I feel her belly. And her belly's nice and soft and comfortable. When I can press it really nicely, and she's not painful. It doesn't feel full. So basically, just to summarize, the kind of only abnormal findings we're seeing is the drooling, the discharge from the nose, but she won't even let me look in her mouth. She's a feisty little cat. It's actually quite hard for them to look at in the mouth. And I just saw an excellent thought about potentially a poisonous plant. And we're going to hold that one because we're going to talk about that soon, because you're absolutely right. Foxglove is poisonous, and Pearl was eating plants outside. So right now, we know that there's something going on, but let's kind of use this information to kind of make a differential. And I think a toxin, eating something that she wasn't supposed to outside, 100% could be that. I often do see drooling as a sign of a toxin. And the toxin I see drooling the most with is either mushrooms. So eating mushrooms when they're not supposed to, because that can cause some drooling, or getting into compost sometimes can also cause drooling. And different things like foxglove particularly, it would cause an abnormal heart rate. So luckily for Pearl is that that's normal. But let's kind of break down the other kind of possibilities of what can be going on. So when I have a cat that's coming in for kind of gagging and coughing and things like that, these are the things that I think about right away. And we'll go for the reasons why. The first is infection. Did she somehow get an infection? There is some discharge from the nose. She is kind of coughing. Could this be kind of like a cold, like you or I can get? So cats get viral infections that are very similar to colds. These are either called a herpes virus, or there's another one called calicivirus. And they can often get them from when they're a kitten, and then when there's sometimes with stress, they can come about. So that's definitely a possibility. But the one thing that would make me think less about an infection is that little bit of snot she has there. It's not yellow, it's not green, it's nice and clear. So generally with infections, I get color in that discharge. So, but it's not completely, it's something that we should definitely keep considering, but it's not a slam dunk. The other is sick to her stomach. She's vomited. Maybe if she's drooling, that likely means she's nauseous. So maybe she's eaten something, not necessarily a toxin, but eaten something that just doesn't agree with her. Cats and dogs have a tendency of eating some gross stuff. And like I said earlier, if you hadn't seen, I have a cat that gets into the garbage all the time. And often that can make them not feel well. But generally, when that's the case, they just need some anti-nausea medications to make their belly feel okay. And they don't need any crazy interventions. Again, one thing that's going to be a little bit odd here is generally when I have sick to their stomach, if I push her belly, she doesn't like that. If you've ever been sick to your stomach yourself, getting big push into your belly, it makes you nauseous. It makes you kind of painful. So not 100%. And the last one is a foreign body. So something is stuck. Her owners had mentioned that it seemed like something was stuck in her throat. And I think that is definitely a possibility. It seems like she's trying to bring something up. So one important distinction that a lot of people kind of think when they think stuck in their throat is they think stuck in their trachea. So the windpipe that brings air to your lungs. And generally, that's not the case. If you get something stuck in your trachea, it's not something that you can kind of just cough a bit and not be too worried. It's something you're going to be constantly bothered by, and something that you would see other signs. So we would see her having signs that she's not getting a lot of air. So it's probably not something like that, but definitely something else could be irritating back there. So this is where we kind of start to narrow it in. So this is now we need to do some testing. And often what I have the ability to do for a case like this is I have the ability to take some images. So that is either an X-ray, a CT, or a CAT scan, or an MRI, ultrasound, but probably not for this case. And then there's also blood work. So what blood work is analyzing the blood and either looking for signs of infection or looking at organ function. So how her kidneys are functioning, how her liver is functioning, things like that. And then finally, I can't get in her mouth. So sometimes we need to give our animals a little bit of sedation to allow them to relax so we can do a really thorough exam. So does anyone know here, if you were to pick one, imaging, blood work, or a sedated oral exam, what would you do first, do you think? Does anyone have anything you can type in the chat or yell out that they would maybe want to do first?
I know we have some talkers in this
Okay,
group.
blood work. Okay, yeah. I think blood work's a great option. And I think blood work would be a really good way to assess for an infection. So what we could do is we could run a complete blood cell count and look for a sign of infection. So let's say we do that. We run a complete blood cell count on Pearl, and her complete blood cell count is actually normal. So doesn't look like there's an infection here today. So then we might decide, okay, well, let's do some imaging. So right here, this is a photo. This is a CT scan of a cat. And as you can see, can you everyone see my mouse? Great. So this is the nostrils. So this is right here on your kitty. And this is your sinus cavity. And there's a bunch of turbinates back there. And this piece right here, this is actually air. So this is what air looks like on a CT. And this is the soft palate. So if you can put your tongue on the top of your mouth, there's a cat. If you can put your tongue on the top of your mouth, that's your soft palate. And there's a part that goes down and that opens up into the back of your throat. And this is where your trachea and your esophagus. So where your food goes and when your air goes is right in the back here. So this is a great way. Something like a CT scan is a great way to assess, is there something stuck in this soft palate? Cats can get things stuck back there sometimes, but it's a little excessive. We don't need to do that because the first step would be to actually give her a little bit of sedation and just look ourselves. And that's exactly what we're going to do. So just so everyone knows, the next picture is going to be me doing that exam. So this kitty that's coming up is sedate. And so she doesn't, this is not painful for this cat at all. So I have an assistant holding up her mouth, and this is my laryngoscope here. And I'm looking, and there is something back there. So I've pulled her soft palate back, and there's a little piece of something back there. And here's a better picture of it on this side. So what is that? So something's been dangling back in her throat, and she's going, because there's something stuck. So let's pull it out. It does look like a thorn, but look, and it keeps going and going and going. And it is a piece of grass. And this piece of grass was about 8 centimeters long. So like I pulled and pulled and pulled, and that cat felt great after. And this is something I see all the time. When I see these cats come in, they're come in, it's always the same story. It's that they all of a sudden they were outside and now they're just and I tell the owner, I'm like, your cat has grass in their throat. And they go, oh no, I don't think so. And then I go, just wait. And I sedate that cat, and I always pull out the biggest piece of grass you've ever seen. And then here, down in this corner here, this was fun. This was a very holiday one. I actually pulled out tinsel from a cat that after that ate a bit of a ribbon from a present. And this was again pulling it out. And what happens is that they go to eat it, and they're eating it, as you may have seen your cat do, ferociously. And they must have snort at some point, and it gets stuck back at that soft palate that we looked at, and it gets stuck up in there, and then it just dangles down a little bit. And this is something I see all the time. So one thing to note is that if you ever see your cat doing these signs, it could be something is actually stuck in their throat, and they need someone to go pull it out. So I know that's a little shocking, but does anyone have any questions about that? These are one of my favorite cases in emergency, because this cat goes home feeling great. And I don't always get to fix something right away, but this is just like a quick fix. So really, really fun cases, and one of my favorites.
Ellen, I have a question
Yeah,
actually.
yeah.
So I'm wondering, when you sedate the cat, like how long does it take for kind of that to work, and how long does it take for that to for them to like feel normal afterwards? Is it like
Yeah.
a full day or?
Good question. So generally when I sedate a cat for something like this, I place an intravenous catheter. So basically an intravenous catheter goes into their vein, and then I give them kind of 2 different medications. I give them one that's reversible. So a sedative that just makes them a little groggy, but I can reverse it right away. And then I give one that I can kind of titrate to effect. So I can give just the amount I need to make them sleepy enough. And then that's all I need. And then it wears off really quickly. So what I normally have when I'm doing this is I have one of my nurses holding the cat's head, kind of like we did before. And then I have another nurse that's giving the medication. And because as I go to pull back the soft palate and pull that out, obviously that's a terrible feeling to get something taken out of your nose. So the cat will react to that. So we give a little bit more sedation, and then that wears off really quickly. So often once we're done, I tell people that they might be a little sleepy, but 12 hours, they should be back to normal, and they're walking and kind of back to their normal selves before they leave the hospital. So here is my cats, and they're risking grass foreign bodies here. And this is what I mean. Look how ferociously Puddle is eating that grass. And that's that they just love grass sometimes. And they just eat it so quick that they can snort it right back up, and then it's stuck in their nose. And I've seen some cases where a cat has had like off and on signs where they seem to be gagging sometimes and then not others. And then months later, we pull out grass. It's quite amazing what can be up there. Okay, so great job. So that's a good question. Was there something time where something was really stuck, like that I couldn't get it? And yeah, so I've had a case before where I try to pull, have you ever seen, there is a type of grass, it's called foxtail, and it has these little thorns on the side. And I've had a piece of that stuck in a cat's nose, and when you go to pull it back, it gets stuck. And how we've had to deal with that is you actually take something called a rhinoscopy. So this is a scope, so almost like a big tube with a video camera on it, and you can look at the back, and it kind of goes up and back into your throat, and then it gets like right up there, and you can kind of grab it out that way. The other way I've had to do it, so sometimes when you pull the grass, it breaks off and then you can't reach it. So then you can flush it out. So basically you go back up, you put a bunch of water and you flush it out the front of the nose. I don't like doing that because I don't know if you've ever been in a pool and you've got water up your nose. It's not a fun feeling. So I try to avoid that. Um, and then kind of the last kind of interesting one is, one time I thought it was going to be grass, and then it ended up being a polyp. So it was actually a little growth that had grown and dangled down, and we were able to remove that and help that kitty cat too. So that's always a really fun one. And now you guys know to look for cats with grass stuck up their nose. So let's move on. We're in ER though, so we need to move on to our next case. So this is our second patient. So his name is Bort. He's a 5-year-old male neutered Pembroke Corgi. And let's see why he is here. So Bort's been vomiting quite a bit. He's been sick for about 24 hours. The owners tried to feed him this morning and he vomited right after. And Bort is one that loves food. And so it's weird that he's vomiting right after. When they got home from work, he was really lethargic. Normally he's a really energetic corgi, and he didn't want to come out. He didn't want to play. He has not had any diet change, but Bort's a bit naughty. He's known to eat things he's not supposed to when he has the opportunity. The only other big thing is that they spent a lot of time the day before in the park playing fetch. Otherwise, he's a healthy little corg. So let's see. Oh, sorry. So let's look to our physical exam. So unfortunately, Bort seems a lot sicker than Pearl did the other day, on our last patient. But we're going to look at kind of a similar thing. So, but for different reasons. So we're definitely going to focus on the belly. And the reason for that is, like I said before, when I have vomiting, I really want to see if they're comfortable in their belly. Oh, someone thinks maybe he ate a sock. It's a really, obviously a corgi could easily have eaten a sock. That's a really great idea. And also one of the first things that comes to mind for me. So we want to feel his belly. We want to see if it is comfortable, but we also want to hear gut sounds. And what gut sounds are is, if you ever, when you're sitting and you hear gurgling, I'm actually listening for that as Bort's doctor. And the reason for that is, when your gut is nice and happy, it gurgles and it digests and it moves things. But when it isn't happy, the gurgling can stop. And that means gas is starting to build up, and that can happen for a few different reasons, and we'll talk about them in a little bit. But also you can get a lot of gurgles, and that can kind of mean some other things, like something like diarrhea could happen. We also, because he's been vomiting a lot and not eating, we want to see if he's overly dehydrated. And how we can do that with a pet is by first examining their gums. So his gums are nice and pink, but when I feel them, when you feel your gums, they're nice and wet. But when I feel Bort's, they're tacky and dry, and that means he's dehydrated. The other thing you can do for a pet to see if they're dehydrated is you actually can pinch their skin. And you pinch your skin and it falls back into place. When you're really dehydrated, or when an animal's really dehydrated, their skin will tent up for a little bit. And you can see that means they're losing a lot of fluid. And that is something that's going on with Bort. And then finally, and this is one of the parts of veterinary medicine people might find gross, but it is very important, is we have to examine the whole dog. So sometimes I do have to do something called a rectal exam, and that's where I put a glove on and I examine his bum. And it's important for me to do that because, one, I got to see if they're, first, like we're looking, we already have it on our mind. Is there something stuck? Is there any foreign material in in there that could be a problem? Or is there diarrhea that's coming? Because that's also going to help me decide what's going on. So when we look at Bort, he's really dehydrated. His gums are really dry. When I feel his belly, it's quite tense. He tenses up and he doesn't let me feel his bowels or his stomach very well. And when I listen with my stethoscope for gut sounds, I don't hear anything. Nothing's moving along. When I do my rectal exam, there's no diarrhea, but he's empty and there's no stool there. So this now, I know some of us have already started thinking about it. Let's think about what could be going on. So foreign people, I've seen foreign body there, absolutely. So dogs and cats both can eat something, and that can get stuck. And this is where we kind of have two different things. So gastroenteritis and a foreign body. And this is where we have different types of ileus. So what ileus means, it's a medical word that means your bowels aren't moving. And that can be for kind of two different reasons. One, something's stuck, not allowing it to move. And we call that mechanical ileus. So there's something in the way that's not allowing things to go through. And then there's functional ileus. So this is where we see gastroenteritis or inflammation of the stomach and the bowels. And this is caused by just not feeling very well. And then what can happen is gas can accumulate, that can be uncomfortable, and then things stop moving. And then we get kind of a vicious circle where gas gets more in the belly, things are moving, increasingly uncomfortable. And then finally, we can have certain endocrine disorders. So what endocrine disorders are is that that's something with a hormone. So certain dogs don't produce enough of their stress hormone. So when you're sick, your stress hormone or your cortisol gets really high, and it helps your body fight off any of that stress or any of that illness. And if you can't produce it, then you become sick very quickly, and you can go kind of from 0 to 60, and this is called Addison's disease. So let's kind of think about with Bort. I see that he might have eaten something that's not food, 100%. So that can be either in functional ileus or the gastroenteritis side, or the foreign body side. And the reason for that is we could have something that's physically stuck, but we could also have something that's just really irritating. I live in Vancouver, and we have a ton of geese. And with geese comes geese poop. And for some reason, dogs love to eat geese poop, but often it does not make them feel very good. And we can have them get the functional ileus from that. And that can be from either maybe an infection like Giardia or beaver fever, or just not feeling good. So I think all of these are pretty good differential. So let's think about what we want to do for diagnostics. So for this one, I think blood work and imaging are two excellent ones. And just for a bit of background, for imaging, generally when we look for things like foreign bodies, we kind of do it in a couple of different ways. One, we can do an X-ray. This is kind of the fastest way I can look for a foreign body. And just a second. Yeah. So this is a normal X-ray of a dog. And let's just orient ourselves here. So this is the spine. This line right here is the diaphragm. So it's going to be the division from your chest cavity to your abdomen. And that's your lung. This black tissue is your lung. With X-rays, the blackness is air generally, and this white area is bone. And so everything in between is kind of like soft tissue. This is the stomach. We can see there's some gas in here. This is not Bort's X-ray. This is a normal X-ray. So there's the stomach here with some gas. The liver is right here. This little guy is the spleen. And these kind of squiggly lines, those are the intestines. And we see here that there's gas in the intestines, but they're all kind of the same diameter. They're not like, there's not a big amount. There's just kind of a small uniform size. There's his bladder right here. And you can't really see his kidney, but it's broken up right there. So that's kind of what X-rays look like. And with X-rays, often things like dogs don't eat. So I saw someone say a sock. So the problem with a sock in X-rays is that once you get your gastric juices into that sock, it's going to look like this color. So it's going to be actually really hard to see a sock on the x-ray, but we can sometimes see gas patterns and changes in the intestine. So area being really big and full of gas, while other areas are small, that can be like, yeah, that looks what we call obstructive or something stuck there. But often we don't actually see the foreign body. And where we kind of end up sometimes unsure is then we end up doing something like an abdominal ultrasound. So basically getting a 3D image of what's going on in the intestines, and that can tell us 100% that there's something in there. So I see that some people are saying blood work too. Blood work's a great one in this case, and it's going to be for a few different reasons. One, blood work's a really good way for me to know how sick Bort is. Is he a dog that's going to need some fluid support? Is he a dog that's going to need to stay in hospital? So that's going to be through the blood work. And how we look at that, we look at his electrolytes. So we look at his potassium, his sodium, his chloride, because all those are getting lost or increasing with the vomiting and the dehydration. The other thing blood work can show us is it could show us if his cortisol is working. Does he have that endocrine disease we were talking about? And it also can show us how his organs are working, or if there's anything infectious. So I see someone said worms. So worms is a great is a great option too. I will say generally with worms, I see a lot of diarrhea and I don't often see a ton of vomiting. But with my blood work that we just ran, I can look at some of the white blood cells that could hint that there's worms. And one of those is the eosinophils. They're a type of white blood cells that increase when there is a parasite. So Bort's are normal. So when we get his blood work back, we see Bort is dehydrated. His cortisol is normal, so that's great. He doesn't have an endocrine disease. His eosinophils are normal. Doesn't look like there's any signs of parasites. So we talk to the owner and we decide, let's do an x-ray. Let's see what we can see. So let's look at Bort's x-rays. And I want to see if anyone can see anything on these. So there's Bort's x-ray. And right off the bat, does anyone see anything in that x-ray? And don't worry, we'll go get a closer look in a second. But does anyone see anything? Yes, that's a ball. Bort ate a ball. So this, unlike what I told you before, when sometimes we don't see the foreign body, sometimes I see a foreign body right there. So just a little bit of a better look for those who can't really see it. This is inside Bort. He ate a full ball. And this is funny. I have seen at least 4 of these cases where a dog has swallowed a ball whole. And they're always quite funny because I always go through the same spiel with the owners being like, sometimes we can't see what's going on x-rays and we might need to go to an ultrasound. And then I come back and I go, there's a ball in his stomach. So ball in the stomach. What do we do? How do we get a ball out? So we have 3 options. 1, we can try to induce vomiting. And I'm going to try to play a video. This is from my hospital. Just so everyone knows, there will be a little bit of vomit in this. So if you don't want to see that, you can close your eyes, but it's a really good video. So this is a colleague of mine. Does everyone see this coming up? It's on Instagram. Oh, great. So this is a dog similar to Bort that we induced vomiting on and brought up the foreign body. So that was a really good one, a really successful one. I gasped when this happened. I had no idea how big it was going to be. But yeah, we'll watch it one more time. One more time. So really good one. So, okay, back to, oh, no. So that's one way. This ball, I measured it. It's too big. It's too big for me to induce vomiting. I don't think I'll get it up. The other reason I don't induce vomiting is Bort's already vomited a ton. So if he was going to bring it up, he would have already probably brought it up this way. So then we have 2 options. We either can pull it out with a scope. So take basically the same camera I talked about before into the stomach, grab it and pull it out that way. That's kind of the most minimally invasive option, but I'm worried about that. When I look at the size of this ball, even though it went in, it's going to be really hard to get out. The sphincter, or the hole that kind of goes from the esophagus to the stomach, doesn't like things coming up. So that's going to be a tough one. So this is one I recommended go right to surgery. And again, just so everyone knows, I'm just going to show one photo during surgery. There's a little bit of blood, but it is worth it. So, but if I'm going to give you a moment, if you don't want to look, don't look. But this was what we found in Bort's surgery. So we opened him up, and his little happy face ball was smiling back at him. So this is his stomach. So in surgery, when I open the abdomen, I bring the stomach out. You can see this. You can see right here. This is suture, and it's pulled up. And I opened up the stomach, and I couldn't believe it. It was smiling. So we took that ball out, we sutured up the stomach lining, and then Bort did really well. And now you can see that he plays with balls he can't swallow. So does anyone, I know this has been kind of a fun case. I'll just move off of the surgery in case somebody doesn't want to look at that. But does anyone have any questions about Bort's surgery or Bort's condition?
I have a question, Ellen. How long does something like that take to heal before he can be like up and running around and playing again?
Yeah, so Bort's a young dog. So these guys are pretty amazing. So what would normally happen is he would spend the night in the hospital, and that's when he'd be getting pain medications. And then he would go home, and he would have probably about 2 weeks of downtime, where then we would only allow him on short leashed walks. He wouldn't be allowed to play fetch or anything, but eating his normal stuff. And then he would have a recheck, and we'd check the incision, and then he'd normally be good to go. And I find these guys, these young dogs, they look like $1 million when they leave the hospital. They feel like nothing has ever happened. The other time is I have times where I have dogs that I've eaten something they're not supposed to. We remove it, and then literally on their way out of the hospital, they're trying to eat things out of the garbage can. So they have no regrets about what they do. And I've had a couple of ones where I've had some reoccurrent offenders where there's one dog I've seen 3 times, and he's eaten socks 3 times, and he's needed to have either endoscopy or surgery. And when we go in, there's always like 4 or 5 pairs of socks in his stomach. Okay, I have another question here. Does the symptoms that Bort experience when having the ball in himself, does that apply to other dogs having those symptoms? Yeah, or can it be different? It could definitely be different. So Bort, with that size of a ball, that's a full obstruction. That ball is so big that he is not going to be able to keep any food down. So a big red flag for a foreign body for me is when a dog is trying to eat, they eat and then vomit right up again. So that tells me that nothing can stay in their stomach. And occasionally that happens when they're just not feeling well. So with the other one, the functional ileus. But often when they're eating and then immediately throwing up, I'm worried about a foreign body. But the other thing that sometimes happens is that sometimes there's only a partial obstruction. So sometimes it's something smaller than that ball, something like a piece of plastic, or sometimes we see cloth, and that can cause a partial obstruction. So the symptoms can kind of wax and wane, and those ones have been more tricky. And often that's when we go to an ultrasound to kind of figure out what's going on. But they can be really challenging. I tell people when they bring their dog in for vomiting, there's a lot of things that cause vomiting, but we often want to rule out the scarier things like a foreign body that can cause a lot of problems. Okay, so this is our final patient. This is Stuntman Mike. So Stuntman Mike is a 7-year-old male neutered Chihuahua mix. And let's learn about why he's here. So he's a frequent flyer. This is Stuntman Mike a few weeks before, who ate a bee. You can see how puffed up he is. So he's been in my ER before, and this was fine. I just gave him some antihistamines, but look how cute he is after eating that bee. So, but why is Stuntman Mike here today? So the owner went to go get him from doggy daycare. And when he walked in, he was in a play area and he called Stuntman Mike. And he was running, excited to see his owner. And then a noise came off the street and he looked and he ended up running straight into a tree, head first into a tree. He yelped when that happened, but then kind of got up, started walking, and seemed relatively okay. But the owner noticed that he's walking with his head kind of low, but he's walking fine. He's otherwise healthy boy, but he does love to eat bees sometimes. So let's figure out what's going to go on. So this is the first time we're not really focused on the belly. We're not really focused on the mouth. We're more focused on his bones and his neuro exam. And the reason for that is that he hit his head right away. So we, one, want to rule out something like a concussion. Dogs can have concussions like people, but we also want to make sure that there's no orthopedic problem or bone problem or other neurologic problem. So we do the orthopedic exam, and I hear someone, you guys are great. Possible neck injury. Exactly. With a low hanging head like that, I'm worried about the neck for sure. So we do a bone exam and we take his arms and we basically flex everything and look for pain. And he does this normally, but he's guarding his neck. So when I go near his neck, he's normally a really lovely dog, but he kind of growls at me near his neck. When we then do a neuro exam, and this is to evaluate his neurologic function. So we start with the cranial nerves, and the cranial nerves can all be tested. They're the nerves that leave your brain, and they can all be tested around your face. So we look in his pupils, we see if his pupils are even, make sure he can see. We do some tests where you kind of touch the inner parts of your eye, and that should elicit a blink in most dogs. So we make sure that he's doing that. We also touch his face and make sure that he has sensation on his face. And then we realize that's normal and we move down. So then we move down to evaluate the spinal function. And how we do that is by doing reflexes similar to you or I. So this is a photo where the dog is on their side and we actually hit their little knee and get the same reflex you or I would have. But we also look at something called postural reactions. And this is how you can feel, like how you feel your limbs in space. So, if you've ever sat on your foot and had your foot go numb, when you go to put your foot down, you don't actually feel it very well. And this is what we're testing, because sometimes if you have something wrong with your spine, you don't feel things very well. So how we do this is I take his paw and I place it like this, and he should flip up because that's a weird spot. So dogs normally will flip up their paw like that, but dogs that are unusual will leave it there. And this was all normal in Stuntman Mike, but he seems to have a lot of neck pain. And sometimes if he had more subtle signs, I may palpate the spine, but he's so painful, I don't want to touch that today. The other reason I know he's painful is we did his vitals. We measured his heart rate. We measured his blood pressure. His heart rate is sky high. And that happens when you have a lot of pain. And his blood pressure is really high too. So this poor boy is quite painful, but we don't know exactly why. So what we're going to do is we're going to give him some pain medication, because when we can give him that, we can make him more comfortable while we investigate what's going on. So let's look at the possible causes of pain in the neck. So there's kind of 3 different causes. One is muscle. So similar, if you've ever, maybe not because you guys are younger, but sometimes when you get older and you sleep weird on your neck, you wake up and it hurts. And that's because the muscles in your neck don't feel very well. So that definitely could be going on. He could have strained or sprained his neck. There could be a bone break or a fracture. He hit that tree pretty hard. Did he break something in the back of his neck or in his jaw or something along the line that would make his neck hurt quite a bit? And then the third thing we think about when we deal with the spinal cord and the neck is a slipped disc. So if you can visualize a spine, so kind of like when we looked at the x-rays before, there's kind of segments of the spine. And in between each bone of the spine is a disc called the intervertebral disc. And if you can picture this disc kind of like a jelly donut, that kind of helps visualize what's going on. So that means there's a harder exterior and then a jelly-like interior. And sometimes dogs with disc disease, what can happen is that disc can get some trauma to it, and that jelly interior squeezes out that side of the disc and then can push pressure on the spinal cord, which causes a lot of pain. And when severe enough, it can actually cause neurologic symptoms. So we can start to see that loss of sensation or the loss of reflexes in the limbs, or they can be really, really weak. So this is definitely a possibility. So I see some people are thinking fracture. I agree, definitely could be a fracture, but I think they're all a viable uh, differential diagnosis. So I think we need to get a little bit more information. So for this one, imaging. We need to look at what is going on with his neck. And then the other option, anytime I have something involving maybe the spine or the brain, seeking a consultation with the neurologist. So a specialist, a vet that has specialized with neurologic disease, so disease of the brain or of the spinal cord, is always a valuable option. So I have the privilege of working at a specialty hospital. So this is a hospital where all these specialists are. So I do have the tools to kind of seek a neurologist and also do these kind of fancy imaging. So yeah, how do we investigate? Is this a fracture, muscular, or a disc? So a first good step, x-rays are a good step. They're going to be a way for us to evaluate if there is a fracture, and they're probably going to look normal if it's a muscle problem. But the problem with x-rays is that they also would look relatively normal if it's a disc. You can't really see discs very well in x-rays. And that's where something like this, a CT scan or an MRI, is really helpful. But I'm not going to rush right away to a CT or an MRI just because I'm not seeing any neurologic signs just yet. I'm only seeing pain. So I think x-ray is a good first step. And I ran this case by the neurologist and she agrees. She goes, "Oh, I don't know if I'd image this dog right away. Maybe let's start with x-rays." So that's what we did. Okay, so this is a good one to look at normal and then look at stomach mice. So this is a normal neck. So here, this is the trachea or the windpipe. This is going into the mouth here. And these are the vertebra of the spine. And this is the vertebra that kind of connects to the skull here. So when you look at vertebra and make sure that they're okay, you look and see the line. You have to imagine the spinal cord runs in the middle of this and it runs right down. So now looking at that, when we go over here, this looks different. It looks like this has kind of jumped up. So this is a neck fracture. And when I saw this, I screamed because I have never seen a fracture this bad with a dog that's walking. So I saw this x-ray and I screamed and yelled to my nurses, "Sedate him right now." Because if you look here, the spinal cord is going like this and making like an S here. So he's this close to having his spinal cord snapped. So if we moved him, it's not going to be good. It could mean that his spinal cord could be damaged, and miraculously it's intact because of his neuro exam. So we sedated him right away and we put him basically in an induced coma with a neck brace so he couldn't move. And I went over and I took to the neurologist and she said, "We're going to need to go in surgery and stabilize that neck." So this was wild. He was extremely lucky. Even a centimeter more of this fracture, he could have completely broke his neck and not been able to walk or maybe died. So luckily for something Mike, that didn't happen. We took him to surgery, and this is him post-operatively with me. And you may be wondering, why is his surgery cut right here? And this is actually how we access spines how we access the spine in the neck. It's called a ventral slot, and you actually come from the bottom instead of from the top. And this is actually because it helps with healing. It's not as vulnerable, and we can stabilize the neck a little bit better. So he's on a lot of drugs here. He's a little bit high, but he's pain-free and he did great and he walked out of there. But I did have a similar case with a less severe one than Stuntman Mike, and he got a neck brace. So sometimes there is a couple different ways. Not all of these are going to be surgical, but for Stuntman Mike, he definitely needed surgery. Um, so does anyone have a question about that case? Because I know that one's a little complicated. So this is my final case. Does anyone have any questions about any of the other cases before we start talking about the different pathways in veterinary medicine? Any questions at all? Nope. Okay. Did anyone have a favorite case? Yeah. I don't know. Then it was just one of those miracle things that his neck moved so far and it didn't damage his spinal cord. It's just one of those really lucky things that happen with medicine. Because honestly, when I looked at those x-rays, they looked to me like he should have had a lot of neurologic dysfunction. But running into a tree, he's just a little guy. He ran in and it just smushed it back up. It's crazy what can happen. So yes, let's how long did it take to recover? It took about these ones take a lot longer than the belly surgeries. He would have been in the hospital for probably about 3 or 4 days, and then he would have had about a month and a half to recover. But the good thing with him is that he had neurologic function. He was walking before, so he was able to go on kind of short controlled walks before he was back out to doggy daycare, but he did really, really well.
Ellen, how long does a surgery like that take? Because it sounds like it's quite complicated if you have the spinal cord involved.
Yeah, so these surgeries, it can be really variable. Sometimes when we go in for those disc ones that we talked about before, sometimes those can be really quick. You go in, you just kind of actually just suction out some of that disc material that's causing the problem, and that can be done within an hour. Something like this, a stabilization, this was probably a 6 to 7 hour surgery. I can't remember completely, but my poor neurologist was in there for a very long time.
So you as an emergency veterinarian, you would not be performing that surgery, or do you like help on it, or what
Yeah,
happens
good
there?
good question. As for I sometimes do surgeries that are a little bit more simple. So, if however that is with surgery. So something like the taking the ball out, I can do that, but I don't touch a neck. So that's where a specialist would come in, and she would be the one that's all she does is deals with spinal surgeries. So she does that surgery to stabilize, but he comes back as my patient into the ICU post-operatively, and I make sure he's okay after the surgery. And that's really important because one, we're going to be monitoring his pain, and we're also going to be making sure that his neurologic function is not changing, because what can happen post-operatively is there can be swelling, and we can see actually a decline sometimes in the neurologic function. So you need your ER doctor or your ICU doctor on that to if that's happening, we can give them treatments and things to stop that from happening. So he ended up being back to me, but I definitely did not do the surgery, nor would I want to touch the spine. Okay. So yeah, so these were some fun ones. And this is what we see on emergency. It's a huge variety. There's a lot of different severities of cases. And we get to see a lot of different things, which is really fun. And why I loved ER is I love the diversity. I love going in and not knowing what I get to see. I love helping these really sick cases and seeing the kind of the craziest stuff. And I like that we are in a hospital where I can do some pretty cool stuff. So now that we've done these cases and you guys are now kind of all budding ER doctors, let's see what we can do within veterinary medicine. So first off, what is the road to becoming a vet? So once you graduate high school, the first step is to get your required courses. So unlike other degrees, the m- big, the big, the big take home with veterinary getting to vet school is actually getting your required courses, and doesn't really matter what your major is. So I've seen people go to community college and get the required courses, and I've seen people do a science degree like me, but I've also seen people do an arts degree and they just have their electives, and that's kind of core animal biology courses. Often there's a genetics course. Knowing chemistry is important because we need to know how all those drugs work and all the physiology within your body. Math is important, and so is English, because you need to be able to write and articulate the findings to those very stressed owners. So once you get the required courses, you can then apply to vet school. And generally, vet school looks at your grades, and that's about 60% of your application. And then there's also an interview, and the interview and animal and veterinary experience is really important. So one thing to note is if you want to be a vet, you do not have to only work in a vet clinic. When I started my application, I had actually never even been in a vet clinic, but I got my animal experience elsewhere. I did an honors project working with ducks. I actually helped Julia at a weir for her stuff. I was able to actually milk dairy cows. So you can have a really big variety in your animal experience. And I actually think that helps you stand out on the application. Not saying that working at a small animal hospital or a shelter is a bad thing, but having a variety, looking at wildlife, looking at other types of species is, I think, a really big asset for veterinary school. And then once you finish veterinary school, that's 4 years. You then write your board exam so you can get your license to practice, and then you can consider doing internships or going right into clinical practice. So once you get here, there's so many options. And one thing that people don't realize about the vet degree is how dynamic it is and how many different pathways there are. Often people think cats and dogs, but there's so much more than that. So there's clinical practice. So that's working kind of on with individual sick animals. And so we see the general practice. So where you take your dog and cat for vaccines, kind of mild sickness, maybe their spay or their neuter. And that's kind of what typical people think of. There's also large animal general practice. So you're working with farm animals, cows, goats, sheep, and or horses. Horses are often by themselves. People are only horse vets. Chickens are another one people work with in large animal. And then there's also exotic general practice. And this is for bunnies, reptiles, geckos, birds, guinea pigs, hamsters, things like that. So that's its own little thing. And then kind of what we touched on with my ER is their specialty practice. So like that neurologist that's specialized, she focuses on animal neurologic diseases, and she gets to do some advanced procedures that not every vet gets to do. And similar to human medicine, there's a lot of options within vet medicine. There is ophthalmology, looking at eyes. There is surgery, where you do like crazy surgery cases, critical care and emergency like me, um, cardiology, dermatology. There's even behavior is one of them too, where you look at behavior and nutrition. And then kind of some of the ones people don't always think of. There is wildlife rehab. There's vets that work to help rehabilitate wildlife. There's also zoo vets. So when you go to a zoo, that zoo has a veterinarian that works with these animals. One of my friends has what I think is the coolest job. She is the dolphin vet for the Navy. And so the Navy has a division of dolphins that she's not allowed to tell me what they do because it's classified, but she gets to be their vet, which is really, really cool. I've been to the Vancouver Aquarium in the capacity as a vet, and I've got to help with eye procedures on sea lions, and we've done the ultrasound of some of the dolphins' hearts. It's been really, really cool. There's also shelter medicine. So you work at the SPCA or the Humane Society, and this is where you get to help the hoarding situations, like where my cat Puddle came from, and you get to look at getting these animals that are rescued back into health so they can be adopted. And then finally, and this is not what people like to think all the time, but there is a role for hospice and euthanasia. So when older pets have a chronic illness that we can't cure, there's a big focus on comfort and providing pain management and making sure they're comfortable. And there's vets that specialize and come to your house and can help with an older pet. So these are all clinical options. But then there's a whole other non-clinical side. So something like what I do epidemiology. I look at diseases of populations. And this means not only do I get to do my clinical side, but I get to study wild populations. I get to study domestic populations. So we'll get into what I've been doing recently with that. But sometimes you, like for instance, with avian influenza or bird flu, that's going to be a vet that's going to be looking at diseases of all these wild birds and not actually treating them individually, but just making management decisions to help them overall as a population. Pathology. So what this is investigating why things died. So sometimes when things pass away, we don't know why. And what a pathologist will do is basically do an autopsy and figure out why an animal has died. And this is important, one, for closure for a lot of people, but also for research and for management decisions too. If there's something infectious, we want to know. Pathology also is used kind of on a day-to-day. So when I send out my complete blood cell count and we look at the white blood cells, that's the pathologist that's looking at that and looking for changes in those and telling me, a clinician, what to do about that. Public health is also really important. With COVID, we know that there can be diseases that infect both people and humans. So these are called zoonotic diseases. And something like, for instance, rabies or brucella, these are all diseases that animals can get and both people can get. So what public health vets do is they work with both the human med and the vet med side to make choices to help prevent both populations from getting disease. And then with farming, there's also aquaculture. So some people don't think of fish when they think of being a vet, but I got to go out when I was doing my rotations and go to these big fish farms outside of British Columbia. And that's where you kind of make decisions on treating sea lice and treating a lot of diseases that can happen within a big fish pond, which is pretty cool. There's also teaching in academia and then industry. So working with pet food companies to make good pet food, or working with pharmaceutical companies to come up with new drugs. So there's so much options to do with a vet med degree outside of just kind of dogs and cats. So it's a really, really cool profession in my mind. I'm a little biased. So just a little bit more about my epidemiological work. So recently I just published a paper about minks and COVID. So unfortunately, minks get COVID at a tremendous rate. They are very vulnerable to COVID. And why this is important is that minks can produce variants just with their composition. They make new variants of COVID very quickly that could infect people. So we have to investigate COVID within minks, not only for the mink's sake, but also for people. And what my study looked at is, if you've ever interacted with a mink, they're not very nice. They're feisty little creatures. And generally how we test for COVID is you have to swab their nose. But mink are semi-aquatic. So they close their little nostrils, don't let you swab anything, and then they'll try to bite you. So it's really not a good way to test them for COVID. So what I looked at doing was actually sampling the mink's environment to see if we could see if the mink had COVID by if their environment tested positive. And we were able to find it does. So now we're able to sample just their manure or the cage they're in and see if that's positive for COVID instead of actually swabbing their little angry noses. And the other part of this is the large part of my thesis work is looking at salmonella. So salmonella is a bacteria that affects people and in particular for my work affects cows. And this is a bacteria that has a lot of antimicrobial resistance, so doesn't respond to antibiotics. So it's important for me to know how it's affecting cows so I can prevent it from affecting people too. So I'm now making a management plan to eliminate or decrease salmonella Dublin in cows in BC. And that not only helps my cows, but it also helps the people that could be infected by that drug or that bacteria. And this is a concept called One Health. And this is something that's very dear to me. So what this concept means is that to have good human health, we also need to have good animal health and good environmental health. And as a vet epi, I get to kind of work in a One Health capacity. So I get to help with diseases that not only help my animals, but also help the people that interact with them, and in turn, the environment. And I just think it's a really nice holistic way to kind of look into medicine. And it's a very different contrast from my emergency medicine. So it's really kind of fun that way. So that is it for my presentation. Thank you guys so much. There were so many great answers and engagement. I loved that. It was really fun. But do you guys have any questions or comments for me?
Ellen, I'll start off by saying that was awesome. Thank you so much for joining us. Like, even me as a cat owner, I'm thinking like I need to remember, like, some of this stuff, right? When like my cats swallow something or need to be taken to the vet. So that was really educational and informative. And I think it's awesome that you shared like all of the different things you can do as a veterinarian. Because you're right, we kind of think of like the cats and dogs that and don't think about all of these other really interesting options. So I'm gonna let our participants think about questions for a few seconds while I plug my phone in. But a question that I like to ask all of our guest speakers is, I guess the preface for it is that oftentimes when we see people who are professionals, we think like, oh, they did everything right to get there. Like what a great success! Look at all of the incredible achievements that they have. But the reality is that everybody makes mistakes and everybody fails, and that's totally normal, and that's a huge part of the learning process. So can you maybe tell us about a time, either as a vet or like along your education path, that you failed?
Oh, so many. So my first year at Acadia, I was a terrible student. I was getting C's. I didn't know how to study. I was just, it was awful. And that was okay because I think people realize you're not going to be a perfect student when you first get into a new environment. And what is important is that you don't let that just get you down. The nice thing about vet med, for instance, is they look at required courses, and they would look at your GPA based on your required courses and then your best selectives. So my GPA wasn't great, and I was able to get in that way. And the other thing that I just think is so important is when I get into vet school, I also wasn't the best student. So vet school is really, really hard. And I went from at the end of my time at Acadia doing quite well because I was getting those required courses and I was really focused. So I was used to getting A's and B pluses. And then my first exam in vet school, I got like a C. So again, I'm still a great vet, and it just, those grades don't define you at all. And it's funny, once you leave vet school, no one cares about that transcript anymore, as long as you pass those board exams. And I also know great vets that have had to do the board exam multiple times, but those grades don't define you. I definitely have a 50 on my transcript in one of the cases, but I'm still a good vet. And it's because those courses are really hard. And I just really would tell people not to focus so much on being perfect with grades, and just live your life. Because the other thing is, I didn't do really well in my first year of university, but I made a lot of friends that are really important. And that was also established me to be confident in university. So again, don't get too down that when you get a bad grade, and I know it's hard because I know a lot of you guys do really well in high school and things, but it's not the end of the world. And it does seem like the end of the world at that time, but I've done many bad tests. Don't worry about it.
I love that answer. Thank you for sharing that. Yeah. We had what happened to the cat? He or she looks mad. That is such a hilarious photo. Oh my goodness. Look,
So
just
I know. I love taking photos of my patients, especially when they have to wear cones, because if you see here, this cat has an intravenous catheter in, or an IV catheter in, and he was trying to lick it. So we coned him and he did not like that. Oh, that's an interesting question. Full-time artist and a part-time vet. So that's a really good question. So I actually have a friend. Her name is Dr. Doris Lung, and she is a vet. And she first went into clinical practice, but again, wasn't for her. And then she's kind of pivoted, like me, to the public health epidemiology side. But what she focuses on is knowledge translation. So she does graphic design, basically taking things like research papers and making graphics and making kind of easy to understand images from those research papers. So it's very digestible from people that aren't veterinarians or aren't in public health. And this is how we disseminate information quickly and effectively, is by making it engaging. So she's really into citizen science and using her art to kind of translate findings that we have from our epidemiological work. So she's kind of both and both, so not completely part-time. But the other thing to consider is, say you're like, okay, I want to be an ER vet, but I also want to be an artist. The thing about being an ER vet is you actually only work, I work about 6 to 8 shifts a month. And that's because they're 12-hour shifts. So they're long shifts, but they're limited. So you actually have a lot of free time there too. So again, it's a really flexible profession. You just need to kind of find your niche.
there's another question. I'm not sure if you see it in the chat. Someone was just asking, because I think someone made the comment earlier, what is distemper?
Oh, great question. So distemper is a virus, and it is a virus that can affect the nervous system of generally dogs, but raccoons can be affected as well, and so can skunks. And this is something that you need to kind of treat early, because it can be deadly, unfortunately. But the good news is that we always vaccinate our puppies for distemper. So if your puppy gets its puppy vaccines, generally they're protected from distemper. And where we generally see it come from is either rescues from different countries where they don't have good vaccine programs. So coming from either like overseas, or even Texas and things, we see some that way, or from dogs that were strays is generally where we see it.
Yeah. And we'll have this as our last question, but thank you so much for all the great questions, everybody. And then Sarah, I'll let you close us out here. So our last question here is from Lily Beth. She said, thank you so much. I had a great time. I would love to keep this as an idea for a future career. Does being a vet, is it only mammals? Could you be a vet for different types of sea life? Great question, Lily.
100%. Yeah. So there's a specialty for fish aquatic within veterinary medicine. So that is focused on fish. And that's kind of normally in, I guess, 2.5 different capacities. So for fish in general, either you're working at an aquarium, so you're kind of the vet that does the research on the fish within the aquarium, and you also keep them healthy. There's also fisheries veterinarian, so you're the aquaculture vet, so working with the fish that were used in a fish farm. And then 3 is it as a capacity as an exotic vet. Some exotic vets will see fish for different things. Like for instance, it's a fun thing you can Google. There was a goldfish that had his swim bladder broken, and the fish, they actually operated on him, and he has a little floaty now that he can kind of float with. So there are vets that do fish stuff too. Fish anesthesia is actually really cool. You do fish anesthesia a lot differently than people or other animal anesthesia. You actually put the medication within the water, and you put the tube of water in their mouth, and it flows through their gills and keeps them under so you can do surgery. And when I worked at the Vancouver Aquarium, I was able to do some fish surgeries, which are really cool. There's also a specialty for bird vets. Generally, that's going to be mostly pet birds, so parrots and things like that. But there's also chicken vets too, so that's another option. And then in the capacity of epidemiology and wildlife, there's rehab is definitely one, but also epi. A lot of my colleagues work with avian influenza, so get to work with birds in that way, or are a pathologist and get to work with birds in that capacity as well.
Great answer. And I'll also say that we have a friend at Terranaut Club who she was actually featured on one of our older online events that I think you can find on our YouTube channel. And Ellen, I think you were maybe in the same one with her, but she is a veterinary technician that works with dolphins at a rehab center down in the Florida Keys. And so what's really cool is she has all of this technical experience, because if you can imagine, you can't just like take a dolphin out of the water and then put it in an X-ray machine. And so part of her job that's also really cool is she helps them train the dolphins. So like, for example, if she has to look in their mouth, she helps train them so that they know what this procedure is, and they just open their mouth up for her. So that's also really, really cool. But I know everybody's thinking about different types of animals they want to work with. Thank you for answering all of those questions. And yeah, Sarah, I'll let you close us out.
Yeah, I was just going to say one thing to add on to Lily Beth's question. I don't know if you've heard of MARS, but the Marine Animal Response Society is kind of a thing in Nova Scotia that you might know more about it, Ellen, but it's, when there's like beached whales or dolphins or seals, really any marine life, they have a bunch of staff there that go and, try to float the whale, or if it's dead, they'll do what Ellen was talking about with the pathology, so they'll figure out why. So there's also really cool jobs there. I actually just signed up to be a volunteer with them, because they always need lots of hands on deck. So maybe in the future, Lily, when you're a bit older, there's some you can volunteer right in your own backyard, which is pretty cool.
Sarah, do you mind if I just add a quick thing to that?
Please, yeah.
At the Atlantic Veterinary College, so in PEI, where any maritimer would go to vet school, that is also the leading vet college on whale diseases, because we have a pathologist there that specializes in whales. So all of those beached whales that we were seeing in the news, they go to the AVC, and you can always tell because it is very stinky when they arrive. But students get to be a part of that research and get to be a part of doing those pathology and doing those autopsies to see what's going on that's wrong. And what's kind of cool, and obviously it's a little sad that obviously the whales have died, but because of that, the Atlantic Veterinary College has really awesome skeletons and things of whales, and doing great research to figure out what's going on with why they're becoming beached.
That's really cool. Wow. I have to do a little career change. All right. Well, thank you so much, Ellen. That was amazing. I was so excited for it, but I didn't know that it was going to be, yeah, those cases were unreal. The ball, I'm gonna see that in my dreams now. But yeah, thank you so much, for your patience with all of this. This was great. Thank you to everyone who came out and stayed. Naomi, I'm really sorry that the PowerPoint didn't show up for you, but I will definitely send you the recording so you can see all the slides that was matching everything you were hearing. Yeah, thank you everyone for coming out. Just a reminder, if anyone does want to use this as their earn your way back activity, you do just still have to fill out that short 5 to 10 sentence report. You can find it on our website on the earn your way back tab. There's no rush. You have it until May 10th, but just make sure that you do that if that is your plan for your activity. So yeah, thank you everyone. I know we went a bit over time, so I won't keep you any longer, but hope you all have a great weekend. And again, if you have any questions, please feel free to email me. If you have more burning questions for Ellen, you can maybe email her, but you can email me and I can communicate them. yeah, we're all friends here. So we will
Definitely.
get your
And
questions answered.
thank you so much for everyone for participating. I love getting all those ideas and they were so good. And I can see you guys all being budding ER doctors.